Good evening, good afternoon, good morning, everyone. Welcome to the sessions wherever you are signing in from. My name is Muttarika Priksapong, often known as my Program Management Officers of the Global Education and Training Institute of the UN Office for Disaster Risk Reduction based here in Incheon, South Korea. Very warm welcome to all of you attending this MCR 2030 learning webinar sessions. We're going to be focusing today's session on the introduction to the Scorecard Action Guide, particularly the chapter on prioritization of the disaster risk reduction actions. The event today is organized jointly by UNDRR, as well as the ARISE Private Sector Alliance for Disaster Resilient Society, under the umbrella of the Making City Resilient 2030 initiative. Today's session will primarily be in English, but we have simultaneous interpretations available in French, Portuguese, and Spanish. So you can click the globe icon at the bottom to select the language of your choice. And the session today will be 90 minutes. And I would like to announce also a little bit of the housekeeping memo. And all of the participants' video and microphone will be disabled throughout this online sessions. The chat box will be open for you to exchange and have interactions among participants. Please refrain although from posting anything related to self-promotional material or any disturbing messages. And we'll be welcoming questions from all of you through the Q&A box later on in the sessions today. So without further ado, I would like to warmly welcome you to also meet our guest speakers for the welcoming remarks. Both of the speakers will be doing the messaging via the video recording. And first up in line is Mr. Sanjay Bhatia, Head of the Global Education and Training Institute of UNDRR. Please welcome Mr. Sanjay Bhatia.
Welcome to this very important session on the prioritization from the Disaster Resilience Scorecard for cities. This is part of the webinar series that many of you have already participated in, which is under the umbrella of the Making Cities Resilient 2030, the MCR 2030, which has more than 1,580 cities, almost 1,600 cities, covering almost a population of 500 million urban residents around the world. As you know, we help cities pass through the resilience journey, which is the stage A, the B, and the C. At the same time, we provide them with tools, including the Disaster Resilience Scorecard for cities. Now, one of the gaps in the use of the tool was that the tool can help us identify areas for improvement. It can help us identify where we are, where we need to go. So in a way, it is a diagnostic tool, but it does not explain to us how to prioritize all the actions or all the projects that we may need to address these gaps. So this guide, which our resource persons will talk to you about soon, is about how to use the scorecard to identify gaps, to identify actions, and then how to prioritize amongst those actions so that you can be on that first step towards project preparation. We take this opportunity, of course, to thank the members of the ARISE network, which is a private sector network helping not only local governments, but also national governments around the world, and also helping other private sector units to adapt and adopt resilience measures so that they can be better prepared and they can face disasters better and with less losses and damages. So the ARISE network partners have been very important in developing this guidance, and two of the members will be presenting this guide to you today. So with this, again, I welcome all of you, and I know we all look forward to this presentation and the discussion that follows. Thank you.
Thank you. And next in line, we also have Mr. Hans-Peter Toffers, the co-chair of the ARISE board, that will be welcoming us via the video recording as well.
Good morning, good afternoon, good evening, ladies and gentlemen. I want to welcome you to this important webinar where our private sector US colleagues are going to introduce an action guide complementing the Disaster Resilience Scorecard for cities. As co-chair of the UNDRR ARISE Private Sector Alliance for Disaster Resilient Societies, I congratulate all parties, and in particular ARISE US, for their efforts to make the Scorecard Action Guide a reality. This guide helps to renew and accelerate action for delivering on the Sendai Framework's promise to prevent the creation of new risk and reduce existing risk while continuously investing in resilience. The action guide on how to create a prioritized action plan and prepare projects as a complement to the Disaster Resilience Scorecard for cities is the result of contributions from the ARISE US network in collaboration with the UNDRR and the Making Cities Resilience 2030 initiative. Building resilience requires an all-of-society approach. At the local level, for example, cities need to address weaknesses or add strength in various systems like infrastructure, health, welfare, education, social, economic, and environmental. Each system has different owners, interests, stakeholders, and timelines, making it challenging to manage technical requirements and critical pathways. As a first step, cities can better understand these systems thanks to the UNDRR Disaster Resilience Scorecard for cities. On the context, actors and interactions are understood. A second step is needed. The second step is how to prioritize the most needed actions and decide how best to move forward. In today's webinar, you will be introduced to the Scorecard Action Guide. The presenters will share more details on the methodology and how to do this thing using a framework that prioritizes action using data from the Scorecard assessment. I would like to underline that this action guide was built considering feedback from local governments and stakeholders. Engaging the private sector and other stakeholders is crucial to implement the calls from the midterm review of the Sendai framework. The work of ARISE, in collaboration with the public sector and other stakeholders, helps to mainstream disaster risk reduction into the strategies, work plans, and on-the-ground action across 4 focus areas of SMEs, infrastructure, finance, and insurance, in addition to the early warnings for all initiative that UNDRR co-leads. The midterm review of the Sendai framework calls for the global community, including local governments and the private sector, to enhance efforts to scale up disaster risk reduction financing instruments and investment in disaster risk reduction, to improve mechanisms and formats for risk information sharing to ensure its use in decision-making in all sectors, and encourage ARISE members to work in public-private partnership and provide innovative solutions where possible, and to strengthen comprehensive disaster risk governance by including business and professional associations, private sector, and financing institutions, among others, from youth to science to groups most at risk, and encourage ARISE to continue engaging and collaborating with states and stakeholder groups. This action guide is an excellent example of how we can start to act on the results of the review and accelerate our work in building resilience. We cannot hope to realize the Sendai framework and SDGs without all of society. Let me reiterate the importance of the MCR 2030 and ARISE initiatives and the collaboration between them, because they assert UNDRR's commitment to working with all stakeholders with a think resilience approach. With that, I would like to give back the microphone to the moderator Wishing everybody a successful and intense meeting today. Thank you.
Thank you so much, Mr. Hans-Peter Stoffers. This piece of the action guide is really exciting for us actually because it's addressing the gaps that we have been hearing, the feedback from the local governments. And in this session, it's a very good opportunity for us to also hear from the experts behind the scene who have developed the methodologies to help us address this gap. And the session is actually recorded, and we'll be sharing also the recording of these sessions on the website, and we'll be dropping the URL in the chat box. And so without further ado, I would like you to also meet with the experts who will be speaking to you about the action guide today. And joining us here today, firstly, is Mr. Peter Williams. He is the chair of the ARISE US, and he also a retired IBM distinguished engineer. And Peter has been working with us for such a long time, and he was actually the lead author of the original scorecard, the disaster resilience scorecard for cities. And he did that since his time in IBM, and he still continue to engage with many of the public private sectors in driving this disaster resilience work forward. And together with Peters, we have Mr. Benjamin Ryan. He is currently a professor at Thomas F. Frisch Junior College of Medicine at Belmont University in Nashville, USA. And Ben also has been the backbone also in developing many of the addenda of the scorecard, including the public health system resilience and also the food system resilience. And both of them have had the intense experience working also in supporting local governments in applying the scorecard assessment and developing the methodologies towards prioritization of the actions. So let's warmly welcome both Peter and Ben, and I would like to pass the floor also to both of them to show you what the action guide is all about. The floor is yours.
Mai, thank you very much indeed. We've been looking forward to doing this presentation. We've been working extremely hard on the contents of the action guide, and I'll say a little bit more about that in a minute. And we're just looking forward to unveiling this to everybody. In the time we have available here today, we're only going to be able to look over, so to say, take an overview of the methodology and dip into it. We will be delighted to come back and do more detailed sessions with people if that is what is needed. But there are extensive materials around the action guide. We've taken great care to try to create templates and sort of predefined forms that people can use to help structure their thinking. So once you've been on this presentation, once you've heard this presentation, go back, listen to the recording again, look through the materials, look through the templates, and look through the rubric of the methodology, and then we'll be happy to come back and have more detailed sessions or question and answer sessions, whatever is required. With that note, I will just share my screen. There we go. Can I confirm that people can see my screen?
Yes, very clearly.
Very good, thank you. So, as Hans-Peter had said, the scorecard uses a system of systems approach. Cities are systems of systems. If you're going to make a city more resilient, you're going to have to address the needs of each one of those systems. And most importantly, you're going to have to address the points where those different systems interact with each other. Each of those systems has different owners, different stakeholders, different timelines. And therefore, the art of building a single consistent resilience position across a city is complex indeed. The scorecard would have helped many of the people on this phone create a baseline of your current strengths and weaknesses. But like all scorecards, it's a little less effective at helping you work out what the next steps should be. And it's to address this gap that we have created the action guide. What we're trying to do with the action guide is help people move forward from the baseline that the scorecard has created and figure out a coherent program of action that gets them, maybe over a period of years, to the resilience that they're trying to achieve. The action guide has been created, or I should say the creation has been led by ARISE US. We've had help from many people around the world, from other scorecard users, non-users, other experts on different aspects of resilience, and so on. The action guide consists of the following: a summary of the survey that we took to identify needs. That summary will be is in draft and will be available for publication shortly. The prioritization methodology, that is this presentation and the accompanying documentation. Community engagement, that is in final draft and is available for people to evaluate. Funding and budgeting, this is the one that we heard most about, actually, the thing that people consistently find the hardest with the scorecard: how to build a business case and how to secure funds for disaster risk reduction. That is in near final draft and is also available for evaluation should anybody want. And finally, a standards compendium. We've created a listing of global standards that are applicable to disaster risk reduction. That is available for use right now, but we have a project ongoing with Arizona State University here in the US to turn that into an online tool. As I say, this presentation addresses Chapter 2 of the Action Guide. Chapter 2 will allow you will show you how to create a resilience plan from your scorecard data. Throughout, we've used a worked example from a completely fictitious flood scenario. And what we're going to show you how to do is to compile what we call the resilience agenda of actions that are needed to reduce disaster risk in your city. How to create a plan with clear projects that group those actions from the resilience agenda and clear roles. How to identify the benefits that will justify the investment required in each project. How to establish the sequence and priorities for what may turn out to be a multi-year program. You can't make a city resilient overnight necessarily, but so how do you structure that program over a period of years? And how to establish the balance between the best disaster risk reduction value and the political and other priorities and financial priorities that you're also going to face. Life is messy. On the one hand, it can be perfectly clear what you need to do for disaster risk reduction purposes, but at the same time, politics and financial reality will always get in the way. How do you manage that? These slides that we're going to show you have a document version of the methodology, and both the document and the slides are accompanied by templates which you can download to start to fill in to start to structure your thinking. You're very unlikely to be able to complete the methodology in just 1 or 2 workshops. You may want to start slowly and work methodically through it over a period of time. We have some prerequisites for you to some things that you really need before you start the methodology. The first is a completed disaster resilience scorecard, and preferably the detailed version of that scorecard. Where applicable, you should also have completed the public health addendum, the food system resilience addendum, the annex for inclusion of persons with disability, and the cultural heritage addendum as well. The second prerequisite is the disaster risk reduction vision for your city. How does that embrace resilience as a strategic issue? And the third is a governance structure for disaster risk reduction activities. And we include templates on how to structure the governance and the different players that you need to think about including. Just as a quick recap, The action guide is built around the 10 essentials. Those who have completed the city scorecard and any of the addenda that go with it will be thoroughly familiar with these 10 essentials. The prioritization methodology uses the same 10 essentials, the same 10 categories, if you like. So I mentioned that one of the prerequisites was a vision. How do you embrace resilience as a strategic issue? Do you need a separate vision statement for disaster risk reduction, setting out disaster risk reduction goals? Your reliance, for example, on green or grey infrastructure? Are you focused on mitigation or adaptation? What are the respective areas of action for citizens and governments? Governments cannot do it all. How are you going to work with your citizens? And for that matter, how are you going to work with businesses? If you don't already have a DRR vision, you will need to create one. The template shown here is just a very, very high level example. So for example, we envision a focus on equipping the cities to survive a 1 in 500 flood event. We will do this by means of maximizing our use of green infrastructure, careful revision and enforcement of building codes, and neighborhood flood response capabilities supported by sustained community engagement. And we will do this progressively over the 10 years. So these, as I say, they're just fictitious examples. They're designed to illustrate the kind of thing that we have in mind. This slide is a little difficult to read, and I apologize for it. You'd be better going to the template, for which you see the link at the bottom of the page. But what we're trying to do here is indicate the breadth of engagement in governance for disaster risk reduction that you may require. So running down that dark blue column on the left-hand side of the form there, you will need multiple actors from different departments in city government. I just recently, for example, had an experience with a state here in the US where the person that was responsible for the public health aspects of disaster risk reduction had never actually been introduced to the person that was responsible for the insurance aspects of disaster risk reduction. ARISE US actually brokered the introduction between those two people. Most governments were the same, and actually most large companies are the same. When I worked for IBM, it was exactly the same. You'll have people that should have spoken years ago, but haven't. You need to pull them together from the different city government departments. You'll need representation from the medical community, hospitals and clinics. You probably need representation from other tiers of government or neighboring cities, especially where those cities share infrastructure, let's say. You will need organizations representing the citizenry, representing homeowners and renters, representing minorities, representing people with disability, and so on. You'll need organizations from civil society, non-profits, places of worship, community volunteer organizations, and so on. You will need representation from the local communications company or companies. There might be more than one of them: the cell phone, the telephone companies, the internet company. Similarly for the energy company or companies if you have more than one. And similarly again from the water company if you have more than one. If you have private sector transportation operators, bus, train, airport, bridges, and so on, you will need representation from them. Sanitation, waste and trash collection. Representation from landowners and farmers, especially if you're a rural community. From major businesses, the chief risk officer for those businesses. And from small businesses, whether that's through the Chamber of Commerce, industry associations, or particularly active business owners. From insurers, from universities perhaps, and from media and local journalists. And there may very well be others. It's impossible to put an exhaustive list together. Your governance structure for disaster risk reduction needs to include all of these. However, it's not always possible to get them all at the same time, and some indeed will resist becoming involved. So our advice would be start with what you have and work over time to engage the others. Once you've got your governance group together, you can engage them in completing the scorecard if you haven't already done that. But there are really 4 broad questions that you need to answer, and this is the structure of the methodology. What problems are there, and what are the root causes? And it's from that you can create the resilience agenda that I spoke of. How should those actions be carried out? What are the tasks that add detail to the resilience agenda? How should they be grouped into projects? How should the different roles be involved? And how should they be financed? Why? Why should we carry these actions out? What are the financial and the non-financial benefits? And finally, when? When should these actions be carried out, and with what kind of priority? So those 4 questions: what, how, why, and when. The financial and non-financial benefits are also the subject of a separate chapter of the action guide, which is in final draft right now, and as I just said, available for review for those that are interested. So let's get into step 1. I will cover step 1, the what, before I hand over to Ben, who will cover the final 3, steps 2, 3, and 4 of the agenda. So the high-level resilience agenda basically identifies broadly the actions that you're going to need to take to become more resilient. The specific tasks and the priorities will come later in steps 2, 3, and 4 that Ben is going to run through. Step 1 itself breaks down into 4 stages. Summarize the scorecard, create what we call the resilience agenda matrix, and I'll show you that. Identify the resilience agenda actions that you're going to use to populate the matrix, and then the preliminary screen for feasibility, for cost and feasibility, excuse me. So the first step is summarize the scorecard. And this form here is, again, a template that you can use to summarize your results from the scorecard. You'll see the same 10 essentials. The worked example that we're going to use is essential. We'll cover essential 3 and essential 8, which is why they've been picked out in yellow in the yellow text. So create, if you like, you can think of it as the executive summary of the scorecard. What are the main things that come out of your scorecard? What are the main issues that you have in each of the 10 essentials? You'll become rapidly aware that many of those issues are linked. The linkages between those issues are going to be handled later. You'll see that as we go along. Again, I emphasize the examples that we're going to show you that we're showing you are completely fictitious. We made them up, but they concern a flooding scenario in a city. And once again, there is a template for this summary available for you from the link shown at the bottom of the slide. So the resilience agenda has a matrix, and like any matrix, it has rows and it has columns. What I'm showing you here is the rows, and this is, you can think of it as the default set of rows, the standard set. You can start with this set. You may think that they're completely fit for purpose right now, or you can elect to modify them. So for example, you might want to separate out the different infrastructure systems in row number 5, infrastructure and facilities. Or you might want to combine some of those for some reason. Strategy and organization is one that is commonly combined. But these are the starting set. So what is your strategy and vision for disaster risk reduction? What is your organization? What processes do you have? What are the resilience tasks and how are they going to be carried out? What information do you need and what do you need to share? What infrastructure and facilities are involved? How will you incorporate the environment? Essential number 5. We've picked it out as a separate subject. What natural features do you have that increase or reduce disaster risk? How will you involve the community? That's essential number 7. We've picked that out as a separate subject. the society within the city, and all the different groups within it. And the final row is financial, which is essential number 3, the financial architecture of disaster risk reduction. Once again, we picked that out separately as well. So those are the rows in the matrix. The columns are the 10 essentials. So that where you have an intersection between one of the essentials and a row, actions may arise. So under essential 4, pursue resilient urban development, and then row 1, strategy and vision, you may have an action, which might, for example, be something like, let's say, how are we going to amend building codes over the next 5 years to make ourselves more resilient? And so on. You can have actions that arise potentially at any intersection. You don't have to have an action at every intersection, but potentially you can have one or more actions at any of the row and column intersections. And here we have an example for essential number 3 of how you would go about doing that. As you can see, we have the same rows: strategy and vision, organization, processes, information, infrastructure, environment, and so on. And the example here for essential number 3, the original weaknesses are in that yellow box. These are from the summary of the scorecard that I showed you earlier. So the weaknesses are: there's no budget in this city for disaster risk reduction, or there's no protection of the budget for disaster risk reduction. Potential sources of finance have not been tapped. So the city has not done a thorough job in identifying where finance might come from for its DRR activities. It doesn't track the impact of funds. And it also has allocated resources at the moment unequally across different neighborhoods. So what are some of the actions that you might put on the matrix to address that? And you can brainstorm these, and I'll show you some techniques for brainstorming them in just a minute. One is create an atlas of all potential funding sources. You might want to define a strategy for obtaining funds, which organizations to approach, and on what terms are you going to approach them. And the chapter of the action guide on the finance strategy will deal with that specifically. How will you allocate responsibilities for the funds you've been able to accumulate? So those are some of the strategic issues. And as you move on down, let's look at processes, for example. You've got to create a budgetary process for securing and protecting city disaster risk reduction funds. You've got to create a process for identifying side benefits from disaster risk reduction spending. If we spend this money on disaster risk reduction, what additional benefits will we get? For example, if we create a floodable area, a floodplain for a river, we might also get a benefit of creating a public park. So those are the side benefits that you might get, and so on. You can read down that table. Once again, there is a blank template for doing this, included at the same link as the other templates. Oops, excuse me. Oh, my computer is locked up. Just one second. There we go. And this is the example for Essential 8. If you remember, we were taking Essentials 3 and 8 as the example that we're working with. So in Essential 8, the problems that our fictional city had was that the stormwater system was inadequate for anticipated high rainfall events. Another problem that it had was that energy and communications facilities were at risk from flooding. And the third one was that critical highways were at risk from landslides. And again, you can see the actions that you might generate at each intersection of Essential 8 and the rows in the agenda matrix. I stress again, these are fictitious. These are just examples to illustrate what we mean. The template is available then from the link that you can see at the bottom of the page there. So that's step 1.1. Now you've got to think further about the actions that you need to go in that resilience agenda matrix. Sometimes the actions are clear. So, for example, if there was one, there might have been an action, if you recall, under Essential 3, one of the problems that the fictitious city had was unequal spending across different neighborhoods on disaster risk reduction. So you might generate an action that says, collate data on city disaster risk reduction spending by neighborhood. That's probably clear enough to put in the matrix right now. It at least indicates what needs to be done. You need to mount a survey of spending data. You need to analyze your budget and figure out what is being spent on each neighborhood on disaster risk reduction. Eventually, you're going to need to think about how exactly you're going to do that. So who am I going to approach? What analysis do I need? What tools am I going to use? Am I just going to do this on a spreadsheet, or does the city have a general ledger system? For example, thinking further about how to do it is the focus of step 2, and Ben will cover that. But at this point, if you can think of any hows, capture them, but don't worry if you don't have them. When you're generating actions, sometimes it's not going to be clear what you need to do. And you've got 2 broad approaches to thinking through what you need. The first is what we call consensus first, which is basically working with the stakeholders in your city and keeping potential solutions very vaguely defined to begin with, and just build consensus around the broad options. And you do this through discussion and through brainstorming. Those options can then be evaluated technically later and turned into concrete proposals. This will be applicable to areas such as community engagement, which may have a lower technical content than, let's say, how do we make our cell phone system more flood resilient, which will have obviously quite a lot of technical content. So that's one way, consensus first. The second way is research first. You can evaluate solutions by actually researching the problem, perhaps by using nearby universities, or perhaps by using consultants. You should include solutions adopted from elsewhere. In our fictitious example, the city might want to look at what goes on in the Netherlands, where flood proofing of cities is particularly advanced, or indeed in China, where the concept of sponge city has evolved, maximizing the soak away potential of cities. It may take weeks or months, and eventually you might require a full engineering design study. So the research first method is applicable to areas with a higher technical content. They're not mutually exclusive. You may want to combine consensus first or research first. For example, if your research first approach has come up with a particular solution that is going to particularly affect one neighborhood, you will want to get the buy-in of that neighborhood. Or you may want to set the social parameters within which solutions are found. So one would require the research and then consensus. The second would require consensus and then research. And truthfully, which approach you use will to some extent depend on the culture in your city and the culture in each neighborhood, as well as the nature of the problem. One technique that you can use is called the 5 whys. As you put your matrix together, it's going to be critical to be sure that you've identified the root causes of each resilience action. So let's take the example, the stormwater system is becoming less adequate. That was one of the problems that the city, our fictitious city, had. Why is that? Well, one reason might be, looking along the orange strand at the top of the graphic there, that there's more hardscape in the city, there's more concrete and more blacktop around the city. Why is that? Well, one reason for that might be urban development. Another reason for that might be inadequate building codes. Another reason for that might be failure to take opportunities to install soakaways. Following the urban development route, one reason for why has there been more urban development is population growth. Another might be there's lack of smart development. Why is there a lack of smart development? Lack of knowledge of smart development approaches. You don't have people that have been trained in these things. One might be that you've got a culture in the planning and engineering department in the city that's too traditional. Go back to the one about inadequate codes for new buildings. Why is that? It's poor enforcement. Why is that? Because the planning inspectors have been bribed, or there's too few of them, and so on. You can see how you ask the question why up to 5 times until you get to the root cause. You won't always have to go 5 times. You can see some of those lines stop. And you'll also see that some of the entities overlap. That doesn't matter at this point. Identify them and put them down on the matrix anyway at the appropriate intersection. One important point to note is, although we're using Essential 8 here as the example, some of the additional actions that come out on the right-hand side of the graphic there concern other essentials, essentials 1, 2, 3, 4, 6, 7, and 8 in this example. So this is an example of where different essentials are interlinked, and you can be looking at one essential and identify actions in another. In terms of the matrix, you can be looking at actions in one column, and it will identify actions that go to another column. As you work with the resilience agenda matrix, there's different ways you can do it, and I've seen a number of different methods used. You can use large flip charts and sticky notes, post-it notes. You can use those. That may be better for large groups because the groups can work together and the sticky notes can be moved around easily if they're needed. This is a great technique if you're using a consensus-first approach. You could capture the results directly on a spreadsheet and use a projector to project the spreadsheet onto a wall if there are a lot of people in the room. If you're working remotely, you could use an online spreadsheet like Google Sheets or Excel Online. You can also, if you're familiar with it, use an online whiteboarding tool like Miro, or for that matter, the whiteboarding facilities in Zoom. There are a number of different methods that you can actually use. We're going to talk more about cost and feasibility later, but we're also going to, and there is also, as I've said, a separate chapter in the action guide on finances, which is in preparation right now. But you should do perhaps an initial scan of cost and feasibility for the actions in your in the resilience agenda matrix that you're developing. And basically, you want to identify the things that are a complete non-starter at this point, and you want to get the roughest of rough ideas about what's going to be expensive, what's going to be difficult. One way to do that is to use a really simple 2x2 grid with the bottom axis talking about impact and benefits. So low impact and low benefit on the one hand, high impact, high benefit on the other. And then the vertical axis talking about the difficulty. Is this thing going to be difficult to do, or is it going to be easy to do? So in the things that are high impact and low difficulty, get on and do them now. Things that are high impact but high difficulty, you're probably still going to need to do them, and they could well be transformational. Things that are low impact, well, if they're easy, maybe you should do it if funds permit. If they're low impact and high difficulty, you're probably, you know, I've said maybe, you may do them, you may not. You might need to do them because they're foundational. So laying a new, maybe you decide that you need to lay a new section of the electricity grid or something. The impact on disaster risk reduction per se might not be very high, but it's foundational to the other things that you want to do. So you would include that in your program. You'll need to go backwards and forwards between step 1.3, which I've just shown you, and step 1.4. As you brainstorm different ideas, you'll need to evaluate them and do this initial screen for cost and feasibility. That concludes my section of the presentation. I'm now going to hand over to Ben Ryan to continue, and I will continue to advance the slides. And Ben, over to you.
Thank you, Peter, for that overview. So now we're looking at how can we actually generate these tasks into action. So as Peter said, we can flip through different ones that we're going to do. At this point here, we want to work out what can we actually do, what's feasible. Do we just have a nice idea that may not be doable right now? Or do we have a really nice idea that we can actually do? And this is part of a process that you can wrap around to make that happen. So what we would do is be looking at identifying actionable tasks. Then we could look to aggregate these into projects and then define project phases and durations. And as we get towards the end of this step 2, I'll provide an example as well. Next slide, Peter. So to identify actionable tasks, we want to work out, is it doable? Can the task be given to somebody and implemented? So we're looking at different scenarios. Could it be that we have landslip as an issue from heavy rains? Can we put in more trees or different environmental amendments to mitigate the risk of flood? Some of those may be easy options, and they're very clear and can be easily executed. So if you can think as a manager or a director, what can I hand to a staff member and can they implement? And they can be broken down as well so that they're really bite-sized. And I'll talk about an example shortly as well. And you need to keep in mind the tasks may be completed very rapidly with one person or might require months or years. So this is where you can go back to that prioritization matrix that Peter put earlier on and use that to work out what's low-hanging fruit, what may be hard, or what may be easy. Next. And you can see this matrix here, which is in the template or the guide that's been developed. And you can see on the right-hand column there where we're talking about examples of tasks. So it could be investigate national government funding sources. So this is where you're going through that atlas to look at what are the potential funding mechanisms. Maybe there could also be some funding through the private sector. If you've got a large industry in that area, if the community members were impacted by a disaster, their houses are flooded, they will not be able to get to work, or they may not be able to get to work. So there could also be interest from the private sector to help make that community more resilient, to allow the factories or businesses or industry to keep functioning. But that could also drive some government investment as well. Create a prospect list of sources to approach based on what can be done, how easy that is. A key area is identifying stakeholders. And as Peter was talking about stakeholders, it's doing your systems of systems approach. Think about the secondary or third stakeholders that may be impacted by a decision. And then you want to identify participants. Test or simulation exercises can be really good to do this as well. So if you work in disaster or emergency management, you may do exercises with different disaster scenarios. You could start to do this with your tasks or map those out as well. And then you want to move down to agreeing on definitions of what you're going to do. So this is that information row. And if you go across to tasks, maybe there's an ongoing basis to share information and move forward. And let's go to the next slide, Peter. And building on this, you can see for infrastructure and facilities. So you want to identify at-risk areas. So is this due to topography, geology, or is it because of hard infrastructure? Is it because we now have concrete in this area where concrete didn't used to be, which exacerbates the risk of flood? Can we learn to live with the flooding as well? Maybe a tree planting program could reduce the risk of flooding, landslip, or other risks. And then as you keep going through infrastructure and facilities, you can start to see different areas there. And you may want to create a working group because there could be non-traditional impacts that you're not considering that need to be addressed. The environments, so you want to think about the areas that may be most at risk. Maybe you can look at amending the environment in a way to maximize the benefits of living with floodwater, but allowing those areas to also be parks or recreational areas in non-flood times. And as Peter was talking about, you might want to develop some sponge features as well. And then as we move down to the community, you want to be looking at adjusting the plans as needed. You need to bring the community along to make sure you reflect what community needs and expectations are. Because if you don't have the community buy-in, it'll be really hard to build resilience amongst that location. And you can see as you're going down financial, Peter's highlighted there, or we have in the task, it's already an actionable task. So next slide. So generating the tasks. So this is where we're really creating those work items. So this whole process going through the action guide is really creating a system of how you can apply the scorecard right down to action and getting tasks implemented. And you could see here, for example, through the 5 whys, we've had lack of training in the planning department could be an area there. So maybe you want to create some training material. You've also got wrong metrics. Maybe we're measuring the wrong aspects. So create new metrics. Inspectors aren't paid enough. Maybe you can create a competitive salary. Maybe accommodate additional costs. Maybe discuss with other areas what they're using. Maybe you can look to do joint hires of inspectors and sharing them across regions as well. So there's a lot of different ways you can go through the five whys, then coming up with potential solutions to generate those tasks. And as you're doing that, you want to think, how do we do that and that? So you're thinking, okay, how can we train the planning department? Okay, well, we need to develop training materials, but how do we do that? So you need to also make sure you've got the right type of training materials as well. Next. And this slide here, I'll start to talk about an example where this has been applied before the action guide was actually developed. So once you've created a set of actionable tasks, you can begin grouping them into related areas that can be managed as projects within the overall disaster risk reduction program. Remember, we're always looking to improve our resilience. We may have an aspirational goal that we want to reach, but we may not be able to get there yet, but we can build towards doing that over maybe a 10 or even a 20-year period. So we're continually moving forward. And related tasks are really tasks geared towards the same objective. And you can adjust this objective as you go. And this example here is, this was in a place in Cairns in Australia, which is in the northeast where the Great Barrier Reef is, very subject to cyclones, typhoons, or hurricanes, depending which part of the world you're in, and storm surge is a risk. The scenario here is the hospital is on the waterfront and is vulnerable to storm surge should there be a storm surge come through. So part of the getting ready in the resilience aspects here was evaluating that risk, doing the 5 whys, and working out what does the community want. Going through this process, we were able to identify the community did not want the hospital removed and wanted to maintain it where it was. So that gave us a clear task and an objective to work out another plan to allow this facility to keep operating during the time of a storm surge or a flood. An example of this was a building of a facility that provided alternate care. And this facility is used to provide community health benefits in terms of renal services. So there was lots of different tasks to make sure this facility continued to operate, but also had a community health benefit. You could also have this facility, for example, be used for any other community health concerns. Maybe it could be looking at nutritional needs for children. It could be maybe measuring heights. Another example of doing this is very similar to what has happened in Bangladesh with all the shelters that have been built there, evacuation shelters. It's thinking, what can we use these facilities for in the non-disaster time as well? Next slide. And this all stemmed from a disaster. So this was learning the lessons from each disaster, which we're always should be getting better and learning from each event. In this scenario back in 2011, which was really the seminal moment or the driving moment for this to occur, there was the hurricane that came through, or typhoon, which in Australia is called a cyclone, and the hospital was evacuated. This resulted in patients being moved 1,700 kilometers south by air. So this was leveraging the military, different military aircraft. And then there was a temporary emergency medical center set up as well. And since this point, there's been a lot of recognition in many parts of the world as well that we may not be wanting to use school gymnasiums or other facilities for providing healthcare. Talking to clinicians, so that doctors, nurses who provide the care for patients in need, the feedback we got through this process was those clinicians would rather be in a hospital setting that they're familiar with without power in a disaster scenario than in a school gymnasium that could also experience a power loss, because you're moving all the equipment, you've got hygiene issues, patient safety, you've got worker safety. So this completely flipped how we were going to approach this scenario into the future based on this lesson. Again, people are making the best decisions with the information at hand, and we're learning and building from that. Next slide. And then following this process, so the Premier or Governor of the province, the state, said, let's have a look at this. Let's learn what we can do better, which is a very good practice in disaster management. We want to learn what can we do next time round. So we had a multi-sectorial review of public health systems. And what we identified for the hospital, which you can see on the bottom right, in that bottom right image on the waterfront, is we worked out that a sewage pump station was lower than the hospital and was the most vulnerable point for the hospital to operate. Because if your sewage system at the hospital is not functioning, you can't function a hospital. You need to evacuate it. So that was also a moment where we realized the benefits of this multi-sectorial review, because that was the local government that helped identify that issue for the hospital. We then also engaged transport agencies and worked out the evacuation route to the nearest airport was lower as well. So it was more likely to flood than the hospital. And if that happened, that meant that we didn't have an evacuation route. So we're working through all these scenarios over a few years. We were meeting with private sector people as well, looking at, can we use different practices? Can we use primary care physician practices to create an alternate care site? Through this process, we concluded the best option was an alternate care site facility, which is the one on the top right there. And the idea, working with different multi-sectorial stakeholders and the clinicians, was if we can replicate the emergency department or emergency room capacity in terms of resuscitation and stabilization, and then evacuate people using a helipad, that will give us some really good community resilience. So we developed this plan around alternate care site, and over time, community members lobbied government and decision makers, and funding was provided for this facility, which is much, much cheaper than relocating a hospital, but provides a lot of resilience in terms of, if that worst case scenario happens, there's an area of land where field hospitals can be brought in, helicopters can be brought in to evacuate people as people need to be stabilized. So this is an example of, it's not the aspirational goal of let's eliminate this risk, it's how do we mitigate this risk to an acceptable level. And this was an acceptable level which the community was happy to live with. And again, it's now a day-to-day facility. So this is an example of where you could go through the scorecard, start to work through scenarios, and then start to define what is doable. We also worked out that we weren't going to be in a position that we could raise all the critical infrastructure up off the ground level, just because of the sheer cost, and doing a cost benefit ratio. The scenario is people are going to mitigate that risk, but if it happens in a time of disaster, we need to come up with an alternate plan, and that's part of the process. Throughout this entire process, we also highlighted our vulnerabilities up and across the emergency management system, so all the stakeholders knew, if we hit this scenario, this is the need we needed in the disaster time. So that's thinking about our resilience and our adaptive capability as well. Next slide. So you can see here from that example how we aggregated into different projects or tasks, but you can see here you need a budget set up. So what's doable? What can we do? Financial planning and a budgeting group could be set up to do this. It could be as simple as developing a plan, and that is a step moving forward. Create accounting, disclosure, and audit processes for any funds that you may use in a disaster period as well. And then you're looking at doing a benefits assessment and validation. So create a process for identifying dividends. So what are the benefits? So if your roadways become more resilient and less vulnerable to floods, the benefits are that your supply routes, your supply chain is going to increase, its capability of it's going to increase? Or are there alternate routes that you could have vehicles take, and can you build up those alternate routes and capacities in a time of disaster as well? Target and confirm delivery of benefits at the community level, because we're serving community members, households, and individuals. And then implement criteria and policy making and project definition. And I know in discussions with the CEO of a multinational logistics company, something that would be very beneficial to their company, different supply chain routes. So you could work through the budgeting process going, okay, if our community will lose this road, are there plans B, C, and D that we can give to logistics companies so that they don't have their vehicles backed up and can't get things in, and ensuring they're not stuck on roadways. So you can see here that you could be doing this from a government level or a governance, but engaging the private sector will help you develop solutions which will help the community function and thrive. Next. And then as you continue to aggregate the projects, you're really looking at moving beyond the essentials as categories. They've all done their work. These are really focused on thematical grouping. So it's stimulating a thought process to make sure you're going through the 5 whys, asking after that, and that, and that. What can we do next? You're now at a point where you're wanting to go, okay, what are these projects? So you can see spun city planning. So you want to study different approaches. So you could be thinking about the Netherlands, which Peter spoke about, where in the Netherlands, the focus is let's live with the floodwater. Let's live with that scenario. It's if you live in a wildfire area, you are going to get wildfires. How can we mitigate the risk of wildfires? Assimilate projects of flood risk as well. Identify where conditions and water table support soakways. So you're looking at what can we do with our existing environment? Do we need to redirect some water in this little area to take it into another area that becomes a soakaway zone? Identify hardscape that could be made into soak zones. So in some areas, do we move away from having concrete or bitumen? Can we have alternate services or alternate environments that allow water to be soaked in? And then you can see here, maybe you want to create a management team, including stakeholders. Community organizations are key. Often there's the non-traditional sectors, the people outside emergency management will have the solution to a scenario. And we saw that during the recent pandemic with vaccine development. That wasn't government driving vaccine development, that was the private sector facilitated by government. So this is where going beyond that traditional emergency management structure, looking for solutions in the private sector, because they provide most of the services on an everyday basis. So they know the community very well. And then you want to create terms of reference and establish a meeting cadence. So that's really meeting protocol or behaviors, because you want to create that environment that people can disagree, but have good discussions and come out with tangible outcomes. And then as you're starting to get ready for the rollout, you're really looking at creating a map of current and potential soak zones. So if you can think from your city perspective, you're thinking, where are some potential soak zones? You want to be engaging with community members, because there will be a flood of some kind, but it's where would we better off be having the flooding compared to another area? And are there adjustments that we can make? Next slide. And on the previous slide, there was discussion about sub-programs. So we need to be thinking about the sub-programs as well. And at this point, we're not being perfect. We're not focusing on being precise in terms of time and durations. We're very task focused. As Peter mentioned, we're coming up with timeframes. Doesn't mean we're going to stay there. So for example, the 2 previous projects that we spoke about, one might estimate timescales such as budgetary setup, maybe allow 3 to 6 months. That scenario that I spoke about in Cairns, that was probably a 3 or 4 year process, maybe even a little longer until it was fully activated. I would probably say 5 years in total. Benefits, assessment, and validation. So what's the cost of not doing something versus doing something? And what are the benefits of that? Storm sewer upgrade planning. So if you don't actually plan to do these upgrades or these adjustments, and you can't demonstrate you've been through a validated process, such as the scorecard coming into this action guide, getting funding is going to be difficult. The best place you can be is going through that process over maybe an 18-month period to come up with plans that are then ready to be funded and are what some people would say shovel ready. They are ready to be implemented once they're funded. And you can see in this scenario, that planning may even take up to 36 months, so 3 years. And then you look to maybe a rollout, so maybe over 4 years. So this could be a 7-year plan. But you need to start doing the work. And then if there is a disaster or a crisis in this period of time, it's very defensible in terms of your preparedness because you're trying to move forward. You're at least understanding the risk, and you can bring that risk to the local emergency management committee so they're aware of that risk. And then people can develop contingencies and plans should that scenario happen during this 7-year phase. We have plans for each area. And this would also feed into sequencing in step 4, which I'll go into step 3 first up. So again, we're assembling the evidence and we're validating. So this is where we're generating the rationale for each project. This is where you start to have different projects ready for funding, going through step 3 and 4. So it's the why, generating the business case. We have put all the effort into doing the scorecard, going through a strategic thinking process, systems of systems thinking. That's very key to now coming up with what can we see as a potential solution. We can set key performance indicators, which we'll talk through those, and the return, a rough order of magnitude. So we're really assessing what that is. And that can then lead into our return on investment. Next slide. So this is where we want to assemble evidence. Who and or what is exposed to which risk? And how might that change in the future? What are the likely financial and other consequences if the project does not proceed? So you also need to ask those questions. What if we don't do this project? What if we do this project? What is known about each stage? Which costs more? What adverse impacts are there on the community, economy, or environment? Which would be fastest? So thinking about, are there short wins? Are there immediate wins that can make the community more resilient in 12 months? And which option appears to be the best overall? Next slide. So as you're setting key performance indicators, you could set these up as perhaps monetary. Save $10 million over 5 years in flood restoration costs. If you think about recovery, flood recovery is not cheap. Is it cheaper to prevent that from occurring, which we know with the evidence out there, it is a lot cheaper. So can we demonstrate that in terms of money saved? Quantify it. For example, reduce the number of properties exposed to 1 in 100-year flooding from 500 to 50. Are there measures we can do to do that? Are there temporary flood barriers we could put in to help reduce the risk? Again, not eliminate the risk because the flood will happen, but to mitigate the impact on the community. And you can see that on the photo on the bottom right. Maybe that's a scenario, or even the one on the top there. Qualitative, so improve social and financial stability in the region. So you could start to think, how many businesses do we aim to keep operating after an event? Or this could be another proxy of quantification, surveying the community. Do 75% of residents, when surveyed, agree that they believe their neighbourhood is more stable? Or is there a 75% reduction in local business closing down? And you could also gather the data and compare this to other areas where there's been disaster, so you can have a comparison. Are our measures working in compared to other areas that may not have these risk reduction measures in place? Next slide. And then as you're continuing to work through this process and assembling a rough order of magnitude. So you really want to consider the second order of benefits. This is where going beyond the emergency management system or government sector into the private or not-for-profit sectors can really help you move forward in terms of rough order of magnitude. So can you reduce environmental damage? Can you improve services from replaced or relocated costs? Can this result in reduced insurance costs for your community members? Reduce losses outside the city, for example, where a highway that serves other regions is protected. So if you protect this highway, does that mean other parts of the country, state, or province will get access to what they need? Reduced health impacts, for example, disaster-related PTSD, or smoke inhalation from fires. Increased amenity value, thinking about the parks, living with the water, and when there's no water there, you've got parks or playgrounds, and increased neighborhood cohesion and community protection as well. So these are all the benefits you're looking for. So you're looking for really those second order benefits as well. Or you can look at because the primary benefits are really reduced loss of life, reduced injuries, reduced damage, reduced economic impact. But if we do that, you can see all these other second order benefits as well, which all feed into making a community more resilient and more agile and adaptable to any challenges or shocks to systems as well. Next slide. And each project will need to be costed. So you'll need to work out the costing and need to think about cost dividends. So is it actually feasible? There's different scenarios. For example, if a road is rebuilt or a park reconfigured, the cost of increasing soakway space may be less than if soakway work is conducted in isolation. So this is where you're thinking again about this, the systems of systems approach. Updating a building or asset for disaster risk reduction purposes may also save future maintenance costs or costs from loss of service. So it doesn't necessarily need to be a heavy investment in infrastructure. Maybe it's just adjusting some of the systems that are there. So if you're in an earthquake-prone area, rather than having fixed pipes, maybe there's different types of materials you could use for plumbing materials that would be a bit more flexible and able to absorb an earthquake, is just an example. You can see here a Netherlands example is thinking about how can we actually live with this water? If you're in a wildfire area, how can we live with wildfire? There will be wildfire. There's going to be smoke at some point and people are at risk of inhalation. How can we actually live with this disaster risk? And you want to really consider the following, particularly around detailed costings, because before you're going to get final authorization, a decision maker will really want to know what are the cost benefits of this approach. And sometimes you might need an expert. You may need experts in this area, such as an actuary or somebody who can help cost things out. And multi-year projects should have cost estimates for each year as well. So as you're going through this, you can see we've come through the scorecard, identifying areas of need, developing plans as we're going through these steps, started with a rough order of magnitude, and we're starting to now really narrow down as we go through this process. Next slide. At this point, you want to assemble the ROI, or the return on investment statement, and the Chapter 4 of the action guide will give you advice on how to do this. Broadly, you'll need to include the flow of capital and operating costs, the flow of benefits over time, discounted flat cash flow statement as well, and a return on investment with all costs and benefits, including qualitative benefits. That example I gave you with the alternate care site in Cairns, Australia, is an example of going through this process. This is the process that was undertaken. And it needs to be agreed with stakeholders and added to project documentation. So you can see in these images, learning to live with water. You can see raising houses or having houses that can rise up as there's floodwaters. This is an example of learning to live with the disaster risk, because the risk of the disasters will be there. How do we live with those? Next slide. So confirming the priorities and sequence. So we've done all this work. How do we actually confirm what are the priorities and what sequence should we go through? And this is the final step. So this is where we want to prioritize by impact and difficulty. And as you can see on this slide, this is that grid that Peter spoke about earlier on. So is it difficult? So low difficulty, low impact. Or maybe if funds permit, we'll do that. Or is the impact high and the difficulty low? Yes, let's get in and do that risk, implement that project. This can help you prioritize. It also will help you justify to leaders, the community, why you're doing certain things now and not other aspects. Next slide. And you can see here again, going through this, you could even put more grid lines in there to really help you target in where you want to go. And as you're going through this process, you want a multi-stakeholder group to help you through this, because each group has different perspectives. For example, if you want to use a school as a shelter in a disaster time, the education department might say, that's a really big impact on our community's ability to continue. So you may look at that and rank that really as an area that you don't want to focus in on, and this may not even make it to the table, where maybe planting of trees and other aspects that reduce landslide risk could be something that's easier to do, and maybe that's an area of focus, and you come up with an alternate site to shelter people as well, rather than using schools. So this can also drive discussion, and it can also be a final process on what do you include as an action or what do you not include as an action as well. Next slide. And using the examples from earlier, you could see here benefits validation or budget setup. They're the easiest aspects of this to do, and we need those in place to move forward. They then can help develop a storm sewer plan. When once we've got the storm sewer plan, that may be funded. In the United States, an example of upgrading these areas is Miami Beach, raising a lot of key infrastructure. But you can see a benefits validation, budget set up into it, for example, a storm sewer plan's developed. Then you can look to develop a sponge city plan as well, and then you start to roll that out, and you come back through and go through this process over a period of time as well, is what would be recommended, just to make sure you can measure your progress, but also to keep track of your priorities. Next slide. And then as you're going through this program,
al seguir por este programa, puedes ver que estás entrando las duraciones, como hablamos anteriormente. Cuando priorizas esto, de verdad estás empezando a ver cómo refinar la duración de los proyectos y hacia dónde quieres irte. Siguiente, por favor. Siguiente. Un ejemplo de donde lo hemos unido con la ayuda de Peter y el equipo es un ejemplo de cómo puedes aplicar el scorecard en tu comunidad. Es un ejemplo de salud. Puedes aplicar el scorecard y empezar a agregar los hallazgos también y priorizar. Es un ejemplo de un proyecto apoyado por UNDRR, donde aplicamos el scorecard en 14 diferentes talleres en diferentes continentes con 280 participantes. Aplicamos el scorecard, tuvimos a través de este proceso de priorización, desarrollando acciones, ¿qué vamos a hacer de ahí? Nos unimos como grupo para calificar y priorizar esas acciones usando un proceso Delta. Esto vuelve a hacer la investigación y de ahí llegar a tener un tipo de consenso. Puedes hacer el consenso y luego la investigación. Esto es un trato de consenso y lo revisamos y pudimos identificar diferentes prioridades para tratar o mejorando sistemas de salud, resiliencia de sistemas de salud y muchas áreas que tienen que ver con necesidades no médicas. ¿Cómo podemos crear lugares para vivir durante una crisis? ¿Cómo podemos fortalecer de salud primaria? ¿Cómo podemos priorizar acceso?
And also, how can we strengthen ecosystems? So you can see here in terms of public health system resilience, a lot of the feedback from many parts of the world that were contributing to this project wasn't necessarily the bricks and mortar of the hospital, was all the other aspects, as the secondary aspects to the hospital that were key to strengthening health system resilience. Next slide. And then we need to be prepared to adjust for other factors. There will be things that happen. There will be a disaster. There will be different political priorities. Community acceptance will change. You also may have opportunities to take advantage of something else that occurs. So by having this plan in place, you're now in a position to adjust and adapt to whatever happens. There can be time limited grants. So maybe there's a grant that comes out that says you need to have a proposal in by 48 hours. You've got something ready. You can justify it's been thought out. It's got community buy-in, potentially political buy-in as well. And you can start to really be able to adjust for other factors. And this is why ideally you could look to come back and reapply this process maybe every 3 to 5 years as part of your disaster risk reduction efforts in your community, state, province, or at that national level. Next slide. And over to you, Peter.
Ben, thank you. So this has been unavoidably a very quick run through a great deal of thinking and a great deal of development. I said at the start, and I'll emphasize again, that what people now need to do is to take a look at this material and to study it, to think about the worked example, to look at the templates. When you've done that, we'll be very happy to come back and answer questions that you might have and try and assist in any way we can. We can go through sections of the methodology in more detail and so on. But when you've completed this, you should have a governance structure, which actually was a prerequisite for starting. You should have a set of projects that meet the disaster risk reduction needs of your city, broken down into actions and tasks. A description for each project, along with its key performance indicators and the justification for it. And you should have a credible program sequence and schedule agreed with all of the stakeholders, including those in the community. Once you've completed that, your next steps are going to be continue the detailed technical investigation, for example, for engineering work that's required. Continue to identify sources of funding and assemble the return on investment statements and actually apply for those funds. And chapter 4 of the action guide covers that in more, we'll cover that in more detail. Make sure that stakeholders are in agreement with what you're going to do. Set up your program office if you're going to have one, the core staff who are going to coordinate and manage the disaster risk reduction program and all of the activities in it. Start to work on what we call the low-hanging fruit projects, the simpler ones that offer more benefit. And then revisit and update the program on a regular basis, based on progress, based on financial circumstances, based on politics, and so on. So that concludes everything that we have to say today. Mai, I'll hand it over to you. We have a few minutes to maybe answer a few questions now.
Yes, thank you so much, Peter and Ben. This has been a very comprehensive and we can see a lot of work that went into developing these methodologies. And we have to say that it does give the systematic approach to actually analyzing the needs based on the scorecard assessment and help moving to understand what activities that have been identified through the scorecard assessment that should be prioritized. But not only just understanding this priority, the presentation actually captured also additional methodology of how to prepare those actions into project package so that the local governments can actually use that readily to advance into the budgeting and also implementation. There are a few questions that that was seen in Q&A box, and I'm going to try to pick them out and group them in trying to be more systematic in the way that we are feeding you the questions. But there also have been questions around like seeing these approaches as having multi-steps into the implementation. One question in there is which step do you think is the most challenging step and why? And is there any tips to overcome this kind of steps? And secondly, do you think that these steps are actually applicable to all sides of the cities and whether this is actually adding complications to the complexities of the local governance system? And any tips, any suggestions on the cities on getting started to moving towards doing these prioritization steps? Over to you.
The most difficult step is usually the first, isn't it? And just getting started and getting into it. Truthfully, different cities are going to find different parts of this easy and different parts of it hard. It'll vary depending on where you are. It'll vary depending on how much work has been done in advance, or whether you're coming to this issue from new. It's true that it requires a certain amount of time and input, which a smaller community may find it hard to get together. You can easily chart a path through this method at less detail, just to give you an overall guide as to where you're going. You don't necessarily need to drive it down to the level of detail that we're describing here. At some point you may have to, because if you need engineering work in your community, even if you're a small one, that detail's got to come from somewhere, so that you know what you're building and you know what you're doing. But to begin with, you can use the methodology at a higher level to at least set your direction and at least provide the framework. If you're a bigger city and you've got more people available to you to help, then you can go down into more detail. But even if you're a smaller community, do you have a local university that could help you? There is one city in New Zealand I'm aware of, I don't think I can identify them, that actually used where a student completed the scorecard for his PhD thesis. And that scorecard is in use by the city today. Could you use a university project to help you complete the action guide methodology, for example? So there are a number of other options. You know, obviously, if you have the funding, you can pay consultants to do it, or you could pay, or you could ask a local business perhaps to help you with that if they have planning staff. So there's a number of options there. I'm looking at the question, Maya, about might I also think about how DRR inputs and actions in this work may contribute to sustainability goals? And the answer is, oh yeah, absolutely. There's a huge interplay between sustainability and resilience. And there are some things you can do that will improve both sustainability and resilience at the same time. There are some things you can do that are resilient but not sustainable. And there are some things that you can do that are sustainable but not resilient. At different times, you may have to do any of those. You could certainly overlay that kind of thinking on the methodology that we've described to ask yourself, once you've got your DRR action plan together, is this going to make us more sustainable? Are we making the maximum use of ecosystem services, essential number 5 in the scorecard? Or are we damaging nature by doing this? If we are, for example, if we've got to put up a concrete seawall, or something like that, which is not exactly sustainable, but maybe more resilient in the short term, are we justified in doing that? So, if you like, the methodology gives you kind of a background or a tableau against which you can explore the trade-offs and the overlaps between sustainability and resilience. And in point of fact, ARISE US is actually conducting a project on this right now to try to identify how to manage those trade-offs. And we anticipate coming up with material on that over the course of the coming year.
And Peter, just building on that as well, I know talking to colleagues who are local emergency planners that have used this process, and I think you're right, Peter, getting through the first steps key is they start to see this as driving their resilience agenda and their emergency preparedness as well. This could provide a frame. So I've sat at emergency management meetings, you have your monthly meeting preparing for disasters, but this going through this process can actually give you a direction and guidance and help you develop that resilience agenda and keep everybody on track and allow every stakeholder to be engaged and continually build. So I think feeding this into your regular processes in emergency preparedness is ideally designed to do that. And you could have this over a 5-year period going through the different scorecards and processes and continually coming back, and this could drive your projects as well.
Sure. And then a couple of other questions there. Are we integrating the scorecard with other urban planning tools? They've frequently been used alongside. So, for example, I believe I'm right in saying Mexico City has used both the UN scorecard and the original Rockefeller 100 Resilient Cities assessment instruments side by side. So they can be used together. The results from one frequently inform the other. And then the final question, how can Africa cope and manage this scorecard where poor governance, unequal distribution of resources, and inadequate water supply are the order of the day. I think the approach there is at least have a group of you who have a plan to address the things that need addressing. At least have a plan to identify what the root causes are. And once you've got those root causes, at least ask yourselves what is required within that group. Once you've got that plan together, once you've asked yourselves what is required and you've got that overall agenda, that's when you need to start lobbying government officials. That's when you need to start your political campaign to actually get it going. So that question is not an easy one to answer. And, you know, as I said at the start, life is sometimes messy. But that's how I'd go about doing that. At least be clear in your own mind with a group of you, a group of co-planners, co-conspirators, if you like, a group of you. At least be clear in your own minds what you want to do. Then you can actually start lobbying for that. And then this final thing, there's one final question here.
So I think we're going to the one last final questions on this with the interest of time, and to simplify the questions, I think perhaps like you can give a little bit of the comments on how do you think that we can ensure that applying the scorecard assessment and also going through this several steps of doing the prioritization of DRR strategies and actions can actually ensure that we are keeping up to the needs of the actual communities instead of just running through looking at only the capital-based cost benefit analysis. And, you know, basically the community would want to ensure that the actions that get prioritized are actually answering to the needs of the communities.
Yeah, I mean, I have some sympathy with what the comment is here from the anonymous attendee. There is not the coherence that ideally should exist between, let's say, the Sustainable Development Goals, the Sendai Framework, the Paris Agreement, and so on and so on. You can see they sort of overlap. You can see they reference each other, but it's not exactly clear where and how they're supposed to work together. And that, in fact, is one of the things that we're trying to address with the sustainability and resilience work that I referred to just now, that ARISE US is just now starting to undertake. The other part of that comment was about thinking about it from the point of view of the poor. And yeah, absolutely. Way too many cities plan their disaster risk reduction from the perspective of the rich and from the perspective of the more affluent parts of the community, simply because those parts of the community have a bigger voice. The successful city is going to be the one that actually incorporates the needs of all of the different segments of their society, because you can't truly say you're resilient without that. Even the richer parts of the city probably need folks from the poorer parts of the city to carry out certain jobs, running the infrastructure of the city, running shops, and so on and so on. So it's a complete fallacy to think that you can make a city resilient without thinking about the needs of the poor. And I have a lot of sympathy for that comment.
So we actually come to the end of the sessions today, and thank you so much, Peter and Ben, for walking us through this comprehensive guides. And for the audience, we have the action guide, this chapter on prioritizing DRR actions, up online as well, and the URL has been shared in the chat box. All the templates that have been presented are also included in that web page. The recording also will be shared, and you are automatically directed to that link as you are closing this browser. I also would like to extend the thanks to all the interpreters working so hard behind the scene, and also our team who managed platforms today. And we hope that we will be reconnected again soon, and looking forward to having more feedback and comments also from the participants, and look forward for further collaboration down the line. So thank you so much, everyone, and have a good day, good night, wherever you are. Thanks
very much. Thank you. Bye-bye.